This practice is called the progressive muscle relaxation, and it has been shown to be effective for anxiety, for depression, for stress management, as well as some chronic conditions such as chronic pain, cancer treatment, to manage the stress, the pain, the comorbidities like anxiety and depression that goes along with it. It has also been shown to be helpful for anger and as well as insomnia and other sleep difficulties. It can also help with some discomforts that go along with pregnancies and also cardiovascular conditions, as that is highly linked to blood pressure and to stress, which the progressive muscle relaxation does show to be effective. Now, based on most of these studies that are done, it's in 15 to 30-minute increments and done after 6 to 7 sessions. People start to see benefits and impacts of it. So if this is something that's new to you, check in with yourself to see how you're feeling before. So whatever it is that you're symptomatically dealing with, just kind of note it. Check in to see how you're feeling before the practice, check in to see how you're feeling after the practice, and just be patient and give yourself some time. So maybe after a week of practicing it regularly, you can check in and see, is this making a difference at all for me or not? If we are working together in a therapeutic setting, then we will maybe get into a little bit more of assessing your symptoms before and after. So maybe some sort of a rating system that can help us understand where you're at so that we can really see objectively from your subjective standpoint whether this is helpful for you or not. So this can be done lying down. It can be done sitting. So with sitting, you're still using some of your muscles, so you can't fully maybe let go as much as lying down, but it's completely doable. So if you're at work and you want to take some time to do this, you don't have to lie down on the floor for it. If you have that opportunity, like at the end of the night, before you're going to sleep, or when you first wake up in the morning, or you have a private space where you're like, it would feel good to lie down, then you can do it lying down. For today's practice, I am going to show it to you in a lying down position. So find a comfortable space for yourself. I'm going to be lying down right here on the floor. And you can have your legs fully stretched out. You can have your knees bent and leaning in against each other. See what feels right for you. You can do this on the floor. You can be on a bed or any flat surface. You can always use any support you need, like pillows and bolsters and blankets, whatever feels right. And we simply draw our attention to where we are. So I like to start with just noticing where you're located in space. If you're in a room, where are you in relation to the walls, the door, the ceiling, other people? If you're outdoors, where are you in relation to trees and the sky and the wind and what else is around you? Noticing the surfaces beneath you. So if you're sitting or lying down, what is touching your body? And what does that feel like in your body? And then we're going to go ahead and draw our attention to the toes of your right foot. Now on an inhale, we're going to go ahead and really engage and tense the toes up. So you can tense them, squish them, you can spread them far apart, however you want to engage the toes. And then when you find your exhale, you're going to simply let them go. Let's do that one more time. Engaging the right toes and letting them go. Now we're going to kind of engage that whole right foot. However that feels right for you. Maybe you're flexing your foot, kind of pushing through the heels, scrunching the toes, or maybe you're really arching that foot. Just really engaging on an inhale, tense, 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 and release. One more time, tensing and release. Let's go ahead and do that with the left toes. So kind of engaging the left toes, scrunching, tensing, spreading. Once you release, you're fully letting go to the degree that you can, based on your position. And then again. Now let's engage that left foot fully. So flexing, pushing through the heel, crunching the toes, spreading, however that feels right for you as you breathe in and breathe out. One more time. Let's go ahead and draw the attention into that right lower leg. So it's the right calf, the right shin, however you want to kind of engage that lower leg, somewhere between the knee and the ankle. As you breathe in, engage. As you breathe out, there is no right or wrong way of doing this. It's really about tensing and releasing. One more time. Same thing on the left leg, calf, the shin, kind of engaging that lower leg and letting it go. And again, and release. Drawing your attention into the right knee. So maybe you're like lifting the kneecap, engaging that knee, however you do. Inhale and release. One more time. Left knee at your own pace, with your own pace of breathing. Your choice of how quietly or loudly you want to let go. Bringing the attention to your right thigh. We're going to go ahead and engage those really large muscles in that right upper leg. And again. Drawing your attention into the left upper leg, the thigh, the top, the back. Engaging on the inhale. And releasing on the exhale. One more round. Drawing your attention into your glutes and really that whole pelvic area. So the pelvis, the hips, the glutes, however you feel that engagement coming on an inhale. Whenever you're ready, again. And you can play around with different sounds to see if you want to do it silently or really loud or somewhere in between. Completely up to you. Whether it's done softly or with more force, your choice. Drawing your attention into the lower back. So we're going to go ahead and engage that lower back. Maybe you're kind of arching the back off the floor here or away from the chair if you're sitting. Kind of engaging that lower back here and releasing it. One more time. Moving up into the mid back. And there's some areas in your body you may have a hard time knowing how to engage them even. And that's okay. Again, there's no perfect way of doing it. We're just drawing our attention there, seeing how we can engage and kind of connect to it and tense it up a little bit, activate it on the inhale, and then release it on the exhale. Again, here, mid back. Now moving up to your upper back and the shoulders here. On an inhale, tense. Exhale, let it go. Maybe we spend 2 more breaths here in the shoulders. Really tensing and engaging that upper back with your next inhale. And fully releasing it. Let's draw the attention into the top of the shoulders here. Maybe you're pulling the shoulders up towards your ears on the inhale. Exhale, let it go. Scrunching those shoulders back up nice and tight into the ears. And let it go. Moving the awareness into the upper right arm. So whether it's the bicep or the tricep or some combination there, inhale, tense. Exhale, release. And again. Left arm. One more time, that left upper arm. Play around with different ways to engage and release. Moving into the right lower arm. To that forearm area. Again. Left forearm. Into the right hand. So maybe fingers and palm making a tight fist. One more time. Maybe it's a tight fist, or maybe you're like spreading the fingers really wide. Whatever you want to play with. Same with the left hand. Engaging, tensing. Softening, releasing. One more time, left hand. Drawing your attention into the back of your neck. So tensing however feels right for you. Maybe you're kind of arching that neck, lifting the chin up, or tensing in any other way. And again. Moving up through the scalp, the back of the head, the top of the head. Maybe you have no idea how to tense this area. That's okay. Let's play. Maybe nothing in the scalp moves and it makes you just scrunch up your face and ears, but go ahead and play and see what would it feel like if I was trying to access my scalp. And let it go. Not taking it too seriously. Moving into your forehead, eyebrow area, temples. As you inhale, scrunch it all up, tense it all up. And again. Moving to the area around the eyes. maybe the eyelids, upper and lower, maybe even the eye sockets. How do you tense this area really tight and let it go? And don't worry about the funniest faces that you may be making. Feel what it feels like and soften as you let go of the breath. Working into the jaw on both sides. Maybe you're clenching your teeth, really tightening the jaw here. And soften and release. Again, tense the jaw as you breathe in. Let it go. Let's get into the lips. Scrunching up those lips and the nose maybe. Let's do it all together. You're probably going to make a really funny face here. And release. And again. And release. We're going to move into the tongue. We're going to tense the tongue up. Maybe you're pushing the tongue to the roof of the mouth or pulling it back or twisting it, somehow engaging that tongue. Let it go. Engaging all the way from the back of the tongue in the throat, all the way to the tip of the tongue. Let it go. Moving into the throat and the front of the neck, tensing here as you inhale. And release. And again. And release. Drawing the attention into the clavicles. These are the bones right at the front of the shoulder, the collarbones. In that area, can you breathe in and tense? Let it go. One more time. And release. Now we're going to engage the rib cage and the chest, that upper body in the front body as you inhale. And release. And again. And release. Moving into the lower abdomen, or just the abdominal area. Kind of inhaling, engaging, exhaling, releasing. One more time. Now we're going to do 3 rounds of engaging absolutely everything. The toes, the legs, the glutes, the back, the arms, the shoulders, the neck, the scalp, the face, the chest, all of it, including the tongue and the jaw and the temples. On an inhale. Again here on an inhale. Another round. And the last time. And just letting everything be exactly as it is, without needing to change your breath or do anything. We simply check in. What does it feel like to be in this space exactly where you are? What are the surfaces against your body? What's the temperature of the air? What does it feel like within your body? and reorienting yourself back to the space that you're in. The walls, the doors, the sky. If your eyes closed at some point, you can slowly open them and let your body move or stretch in any way that feels natural to you. And finding your way up however feels right for you. Taking your time, taking it slow as you find yourself back into a seated position. And from here, again, we simply check in and we ask ourselves, what does it feel like to be in your body right now? Maybe if you were kind of gauging your stress levels, your anxiety levels, your pain levels, you check in again. What does it feel like in this moment? Without needing it to be one way or another. We're not going to force for the pain to go away. We can't force it to go away. We can't force the anxiety to lessen. We can simply open up and be open to the possibility that maybe this practice can be helpful. Maybe it feels better. Maybe it just feels different. And then being patient with it. So you give yourself that 6 or 7 sessions. 1 week time is not a lot to see if this can be a tool that can help you. Thank you for taking the time to practice today.